Come in.
Hi, how are you today?
Good, how are you?
Good. My name is Gabrielle Smiertelny. I'm a PA student. Do you mind if I ask you some questions today?
Sure.
All right, let's start with your name and date of birth.
My name is Bobby Noonan, 7/24/91.
Thank you. So what brings you in today?
Well, for the past couple days, I've hurt like back here. I think it's called your flank.
Okay.
Severe pain, and I've also had some nausea and vomiting.
And this was the past 2 days, you said?
Yeah.
Is there anything I can do to make you comfortable right now?
Well, some pain medicine would be nice, but if I can't have that, then just figure out what's wrong with me. So.
Okay. Well, let's ask some questions first.
Okay.
Okay. So you said this has been the past 2 days.
Mm-hmm.
Have you had any experiences with this before?
No, this is the first time that this has happened.
Okay. So started 2 days ago. Okay. And does it move anywhere else besides that right lower flank?
Sometimes it seems to move kind of in the front, down like my thigh here, like my upper thigh,
Okay.
like groin area.
Has this been consistent for the past 2 days, or has it kind of waxed and waned?
I don't know what waxed and waned means,
I'm
but
sorry. Has it gotten worse and better throughout this period of time?
Yeah, I feel like sometimes I'll take some, ibuprofen, and it'll go down a little bit. But I guess what really brought me in is that I can't sleep because it hurts so bad.
Okay. Do you feel as though it's getting worse as the days have gone on?
Yeah, I would say so. Like sometimes it gets so bad that it makes me want to pass out because it hurts so much.
Oh. What would you rate that on a scale of 1 to 10 for the pain?
I'd say about an 8.
Okay. How would you describe the pain that you're feeling?
It starts out sharp, like somebody stabbing me in my back, and then it gets like really kind of crampy, and that's when I just feel like I could just pass out.
Okay. Do you feel as though anything is making this worse?
No, it just seems to happen randomly. I can't really attribute it to anything.
Okay. Has anything did anything kind of happen before this event?
Not that I can think of, no.
Okay. Are you having any additional symptoms? You mentioned nausea and vomiting. Are you having fatigue or?
I think I'm just tired because I can't sleep because it hurts so much.
Okay.
I'm kind of haven't really been able to eat either because it hurts. And I've noticed that like I haven't been going pee as much as like I normally would.
Are you having pain with urinating?
No.
Okay. Does it seem to be worse with activity? Like, does it make you just kind of feel like you want to lay on the couch?
I wouldn't say that. I'd say that the pain makes me not want to do anything, but I wouldn't say like the other way around.
Okay.
So, activity doesn't make it worse. I just don't want to do activity because it hurts.
Okay. Okay. What are you concerned that this may be?
Well, I have a friend that had actually, it wasn't my friend. I think it was my dad had kidney stones, and he, I was kind of talking to him about what's going on, and he said that sounded like how he felt when he had kidney stones. So
Okay.
that's what I'm worried about.
Well, let's get this figured out for you then.
Okay.
I'm going to ask you some additional questions.
Okay.
Do you have any current medical conditions, maybe diabetes, high blood pressure?
Nope.
Okay. Did you have any significant conditions as a child? Asthma? Did you ever have the chicken pox?
Nope.
Okay. Have you ever had any surgeries?
About 5 years ago, I crashed my motorcycle, and I was in the hospital for that. I broke my tibia, and I had to have surgery on that.
Okay. Is that the only hospital stay you've had?
Yes.
Okay. Are you taking any medications currently?
I just take the ibuprofen, and I also take aspirin for pain. I don't have any health insurance, so I haven't been able to go to the doctor before today
Okay.
for this,
And
and
it-
it just got so bad that I just have to come.
Okay. So the pain is what brought you in?
Yeah.
Okay. How much or what is the dosage that you're taking of the ibuprofen?
I think I take about 4 pills of ibuprofen, so I think they're 200 milligrams
So
each.
about 800.
Yeah.
And how often are you taking those?
Well, the bottle says every 6 hours, so I follow that.
Okay.
And then the aspirin, I take 2 pills, which is 300. I mean, they're 325 milligrams each,
Okay.
and I take that like every 4 to 6 hours for pain.
Okay. And has this been that you're taking these for pain within the past 2 days, or do you regularly take them for pain?
No, I don't regularly take them.
Okay. Do you have any allergies?
Yep, betadine and penicillin.
Okay. What happens if you were to come in contact with those?
Rash for betadine, and then
Uh-huh.
penicillin gives me hives, and I also get nauseous with it.
Okay. Do you have any allergies to any foods or environmental things?
No.
Okay. Just want to ask you just a little bit like screenings. Have you had your vaccines this year? The flu vaccine?
No.
Okay.
I don't believe in vaccines.
Okay. So you don't have any vaccines?
I think like when I was a baby, my mom made me get all that, obviously, but
Okay.
like the flu, I feel like it gives you the flu, so I don't get the flu vaccine.
Okay. We can talk a little further about that later.
Okay.
Okay. Have you had the HPV vaccine or?
I don't know what that is, but no,
Okay.
I don't.
Okay. All right. Just a little bit about like who do you live with? What do you do? that kind
I
of
live with
stuff.
my girlfriend Brenda.
Okay. Do you guys live locally?
Mm-hmm.
All right. And what do you do for work?
I'm a carpenter, though the pain has kept me from working for the last 2 days.
Okay. Well, hopefully we can get you back to work and back to sleeping.
I hope so.
Have you traveled anywhere recently?
No.
Do you smoke cigarettes?
Yes.
How often?
A pack a day.
Okay. How many years have you been doing that?
About 6 years.
Okay. And do you drink alcohol?
On the weekends
Okay.
with my
weekends.
buddies.
Okay. How many drinks do you say you have?
I'd say over the whole weekend, probably a case of beer.
Okay. All right. Do you use any drugs? Anything like marijuana or anything that
I do smoke
illicit?
marijuana
Okay.
occasionally, probably 2 or 3 times a week.
Okay. Do you feel as though you get exercise regularly?
I mean, at work, I'm lifting a lot of, heavy stuff and, sometimes I'll go to the gym maybe once or twice a week after work.
Okay. Okay. And what is your diet like? What kind of foods are you eating?
Well, Brenda's a good cook, so, she'll make some home-cooked meals a few times a week, and then we usually go out to eat on the weekends.
Okay, what kind of style meals is she making?
Well, she's on this real health kick, so she usually makes some healthy foods.
Okay.
Chicken and vegetables and stuff like that.
Okay. And then how much caffeine are you drinking? Like coffee or soda?
Well, I love Mountain Dew, so I'll drink at least 2 of those a day.
Okay. Is that something that's new, or have you been drinking
No,
this
I've
for a
been
while?
doing that for a while.
Okay. All right. And you mentioned earlier that your dad has had kidney stones.
Mm-hmm.
Anyone else in your family having
I don't
kidney
think
stones?
so. Not that I'm aware of.
Is there any history of cancer in your family?
Mm-mm.
Diabetes?
I don't think so.
Okay.
Not that I'm aware of.
High blood pressure?
Mm-mm.
High lipids or any other?
Mm-mm.
Okay.
No.
Are your mom and dad both living?
Mm-hmm.
Your grandparents?
They've all passed away. I'm not sure what. They all died when I was a lot younger,
Okay.
so I'm not sure what happened.
And do you have any children?
No.
Okay. All right. Just a few more questions about some symptoms.
Okay.
So, have you had any fever?
Mm-mm.
Any weight loss?
Mm-mm.
You mentioned feeling tired from not sleeping.
Mm-hmm.
Okay. Any chills?
Mm-mm.
Have you had any changes in your skin? Is it dry or itchy? Any new rashes?
Nope.
Okay. Have you had any headaches or ear pain,
Mm-hmm.
vision problems,
Nope.
changes like that? Okay. Breathing wise, has it felt like it's harder to breathe,
Mm-mm.
or your chest is really tight?
Nope.
Okay. Do you feel like you've had any swelling anywhere, like your lower extremities, like your legs?
Mm-mm.
Okay.
No.
Does it feel like your heart is racing?
Nope.
Alrighty. Have you had any diarrhea along with your nausea and vomiting?
No.
Okay. And your bowel habits haven't changed,
Nope.
like the frequency? Have you had any other abdominal pain besides that right lower flank that radiates?
Mm-mm.
Okay. You did mention a decrease in appetite.
Mm-hmm.
Okay. And that's been over the past 2 days?
Yeah, sometimes it just hurts too much to eat.
Okay. All right. And you mentioned that it is, you haven't been peeing as much.
Mm-hmm.
What is, and you may not look, but what is your pee looking like color-wise?
It's pretty dark, like dark brownish almost. Like, I don't know if there's a little bit of blood in it.
Okay. And does it hurt or burn?
Mm-mm.
Okay.
No.
How many times are you going a day?
Maybe only like 2 or 3.
Okay. And are you getting up to go to the bathroom at night at all?
No.
Okay. Okay. Well, I'm going to go talk with my collaborating physician and see what we can do for you.
All right, sounds
Okay.
good.
Thank you very much.
Thank you.
It's nice to meet you.
Nice to meet you.
Bobby Noonan is a 28-year-old male that presents today with right lower flank pain and nausea and vomiting. This started about 2 days ago and has been progressively worsening. He states that the pain is sharp and stabbing in character and occasionally feels crampy. He says that the pain radiates around to his front side, especially in the groin, a few times throughout the day, most prominently when he's urinating. He does not believe that anything precipitated this event, nor has anything made it any worse. And he has not had any episodes like this in the past. This is a new experience for him. He's been getting minimal relief with aspirin and ibuprofen. He rates his pain as an 8 out of 10 for severity and states this is the worst it has been over the past few days, which is what brought him in today. He is concerned this may be kidney stones, as his dad has a history of recurrent kidney stones. Bobby himself does not have any current medical conditions, nor did he have any childhood conditions. He had surgery 5 years ago for a fractured tibia and spent the night in the hospital for that. He does not take any current medications due to lack of health insurance, although for the past 2 days he has been taking ibuprofen 800 milligrams every 6 hours and aspirin 650 milligrams every 4 to 6 hours for the pain. He is allergic to betadine, which causes a rash, and penicillin, which causes hives and nausea. He works as a carpenter and lives with his girlfriend. He has been unable to work for the past 2 days due to the pain. He has not traveled within the past year. He reports smoking 1 pack of cigarettes per day for the past 6 years, and he drinks roughly a case of beer every weekend with his friends. He smokes marijuana 2 to 3 times per week and drinks 2 bottles of Mountain Dew a day. His diet is relatively healthy because his girlfriend cooks everything from home. He does not have any contributory family history besides his dad's recurrent history of kidney stones. He reports being really tired, but does not consider it fatigued. He is tired due to the lack of sleep he's been getting from the pain. He reports a low appetite over the past few days and decreased frequency of urination. And his urine has been dark brown and almost red in color. He denies fever, chills, changes in bowel habits, abdominal pain in any other location, headaches, shortness of breath, palpitations, swelling anywhere in the body, changes in his skin, or any blurry vision.